Assalamu alaikum, everyone. Welcome to Radio Ramadan 365 on the late night live show tonight. My name is Dr. Sadia Muhammad, and I'm your host for tonight. I hope everyone is doing amazing, inshallah, and having a wonderful time in Ramadan. Of course, we are on the 23rd night. It could be the night of Laylatul Qadr, the night of power. So, subhanallah, I hope wherever you are, inshallah, you're having a blessed night, a blessed time, and please remember myself and my guest tonight in your dua. So I have a very special guest with me again tonight, Dr. Khurram Sadiq. Assalamu alaikum, Dr. Khurram.
Wa alaikum salam, Dr. Sadia.
Alhamdulillah. So nice to have you back. We were on air 2 weeks ago, I believe, and we were talking about autism on that night. And tonight we've got another very hot topic, a very important topic that we'll be talking about, which is ADHD, attention deficit hyperactivity disorder. So before we start, I'll just give you a quick introduction to Dr. Khurram. MashaAllah, Dr. Khurram Sadiq is a consultant neurodevelopmental psychiatrist in London. He is the ADHD lead in Oxley's NHS Foundation Trust in the UK. He is very well known, mashallah, increasingly becoming, a global phenomenon with his TED Talks, mashallah. He has delivered 5 TED Talks in the area of neurodevelopmental disorders. And if you haven't seen those videos, I would really encourage you to check them out. They're amazing. And we are extremely blessed and extremely fortunate to have, Dr. Khurram with us tonight. So very warm welcome, Dr. Khurram, to the program tonight.
Thank you very much for inviting me again, Dr. Sadia.
It's a pleasure, absolute pleasure. So before we start, I wanted really just to ask you about how your Ramadan has been and how you're feeling tonight on this night that could be potentially Laylatul Qadr.
Yeah, Ramadan had been great. A lot of, I think, community-wise, a lot of work has been going on. My kids and wife has been going to Tarawih. Because of my work, I've been unable to. Mashallah, my sons, they have been leading the prayers. So and I like to them to be leading because I believe that they're better men than I am. So it's great feeling to have, seeing them mature and seeing them following a path of enlightenment.
MashaAllah, that's lovely to hear, and inshallah, obviously your kids, MashaAllah, what they are will be, in part your hard work, your efforts in raising them and nurturing them, and so inshallah, they will be your sadaqah jariyah, and that's amazing to hear that. I was just thinking actually before we came on air, Dr. Khurram, that Laylatul Qadr, the night of power, the night of destiny, it's a very special night. And, we always, we often associate it with, sort of acts of worship, isn't it? We associate it with, reading the your Tarawih, and then you've got your Nafal ibadah, after that, you've got your, reading Quran, your dhikr. But I was thinking, there's lots of ways to worship. There is your ibadah, but there's so much else. Anything that you do with the right intention can be ibadah. And I hope, inshallah, what we're doing here tonight for us delivering this session and people that are listening in, inshallah, and hopefully that will be able to, join with us, maybe through questions or comments, that this will be, if we have the right intention to learn about this, something that's really, important, and that can, that through which we can help maybe ourselves and others around us. And this will also be a good deed and also be a sadaqah jariyah. And I think
Absolutely.
I'm reminded of the hadith of the Prophet, peace be upon him, that the best of you are those who are the most who give the most benefit to others.
That's true. No, no, absolutely. I think it is in itself a big charity. I think, and enlightening people, basically enhancing their knowledge about things that they have been clueless about for a very long time, like imparting of knowledge. That's one of the best deeds that you can have, and which can help not just one person. It's You're not just changing one person's life; it's changing the generation, basically.
Absolutely, subhanallah. So, inshallah, with that intention and with that, premise, we're going to get into our topic. And inshallah, we do hope that we can impart really beneficial, knowledge and advice and real, just words of encouragement and
Right.
comfort, I hope, as well, inshallah. So, I wanted to start a little bit differently tonight, and sorry, just before we go on, I would just like to say that we are streaming live tonight, and you're listening to Radio Ramadan 87.7 FM. You can also watch us online on www.rr365.co.uk. And also, you can join us on Facebook Live, the Radio Ramadan 365 Facebook Live page, and also on Radio Ramadan 365 YouTube channel. And I'm really hoping that people are able to listen in live and really interact with us, and send their comments and questions. I'm not able to see them right now, but I'm in touch with the studio, and hopefully they will be coming in, inshallah. So please, I would encourage anybody that's got any questions. You've got an amazing personality here tonight, and please make use of the opportunity. So, Dr. Khurram, moving on, just I wanted to start a little bit differently. Rather than kind of getting straight into kind of what is ADHD,
Mhm.
I wondered if I could ask you about your story,
Yeah.
because you have a personal story.
Yeah, I have a personal story. Yes. Like, I've got ADHD, and again, it's been a very difficult path, because whilst growing up, especially in Pakistan, in a very small town, people were clueless, and again, uh, it never transpired as to why I was the way I was, and it used to confuse me. It used to confuse my parents. It used to confuse everybody about around me, because there were flares of brilliance, and then there were some things which were completely contradictory to that. One year I was brilliant, the next year I was almost um, just 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 actually barely passing the exams or passing the classes. I was called lazy. I was called somebody who was avoidant of the work, and for such a long time I believed that I was quite dumb, um, because I used to read things and it would not comprehend to me as to what I was reading. I had to reread things. The things would not stick in my mind unless I read them a day before, and that I became a lastminute.com. I was known to be leaving things till the very last minute, and I went through phases of going through my GCSEs like this, the A levels equivalent at that time, and then the worst test was the medical school, where it became so boring for me. And somehow I managed to pass, and it was not until I gravitated towards the subject, neurodevelopmental psychiatry, that I came to know that I have something which is called ADHD, attention span, concentration, distractibility, uh, poor organizational skills, not retaining things. Um, People would tell me that I have so much energy. For example, I would travel 4 hours a day, and then by the time I would come home, and my family would say, "How come you're so fresh?" And I would work till 1 o'clock, 2 o'clock in the morning, getting up at 6 o'clock, 7 o'clock, and somehow I have managed that routine. But knowing is a big blessing. Knowing that I had that condition, and that explained a lot of questions to me. So I put a lot of uh, defense mechanism or coping mechanisms in place so that it could help me, and things started to change. So it was quite difficult for me, and it was quite difficult for my parents. And when I look at my father, he was ADHD, and nobody picked it up till he passed away. And then when I started reflecting, I came to know that we our personalities were very similar.
Subhanallah. Subhanallah, Dr. Khurram, that's quite a story.
Yeah,
Um, when you were speaking there, you know what struck me was you said that you thought you were dumb.
yeah,
Subhanallah. I mean, that is just one word I would not associate with. I mean, actually, I don't use like using that word because I think it has,
yeah,
wrong connotations. But I know what you mean, that you didn't think that you were
yeah,
smart, intelligent, capable, and that is absolutely not what you are.
yeah,
You're you're absolutely everything opposite to that, mashallah. But it just makes you realize just how this condition can
yeah.
impact on you, that it can really affect the very core of your very core and your very belief about yourself.
Absolutely. And people do not realize that a person with ADHD, they have to work twice as hard or thrice as hard as a person who does not have ADHD. The energy that it takes to complete a task or to undertake a task, it's so much more as compared to what other people are doing, because you're not just focusing on the task, you have to focus on yourself to focus on that task, and you have to literally hold your brain in your hand and to make it look at that thing, not letting it distract away.
Hmm. I wonder, Dr. Khurram, if we should maybe at this point sort of explain more about
Yeah.
ADHD itself.
Hmm. Yes.
We've been using the synonym, and it's not synonym, sorry, I'm using the wrong word. This acronym,
Acronym. Acronym.
yes, and I'm
Yeah.
I'm not sure if we actually actually spelled it out, but
Yeah.
it's such a topical term, isn't it? That you think
Yeah.
everybody
True.
knows. But ADHD stands for Attention Deficit Hyperactivity Disorder. And it'd be great if you could
Yeah.
explain what that means and what, someone with ADHD can
Yeah.
present with. Yeah.
Yeah, as the name implies, attention deficit and hyperactivity. So these are the things that are very prominent. It's a neurodevelopmental disorder. It means that people are born with it. It's a genetic disorder with some environmental factors that can actually attenuate the process and accelerate the process. For example, low birth weight babies, or smoking or alcohol use during the pregnancy can actually lead to, they say, to the development or pathogenesis of ADHD. Now, people who have got ADHD, there are three types of ADHD basically. One is called the predominantly inattentive type, in which the presentation is of inattention. So there's inattention, there's a poor attention span, lack of concentration, lack of focus, distractibility, poor organization. Like their room would be like a bomb site. That's how people with ADHD explain their room, and they say that eh, they don't use wardrobes; they use floor robes. So everything is on the floor, whether
Right.
it's clothes, it's their books, it's the empty wrappers, despite the dustbin being present, dirty utensils, everything. It will be. Um, they usually are late, or they are too early because they have developed the coping mechanisms so that they do not miss appointments. But it takes them so much energy to have that system in place. uh, they have poor memory, they leave things behind. I can tell you the number of times I have forgotten my laptop. One time it was I was traveling to Istanbul. I was in transition and I went to the food court. I left my laptop and everything in there along with the passport. By the time I realized it was 10-15 minutes, I rushed there. It was taken away, but luckily it was security. It was not the first time I have left my laptops, my bags, so many different places. Same thing happened with kids. They leave their jumpers, they leave their coats, they leave their bags behind. They have to come back to get things. They find it difficult to follow instructions. So this is the inattentive type of ADHD. And
And just when you're describing that, Dr. Khurram, it's, you know, I mean, I'm sure we've all forgotten things, you know, at some
yeah,
point, you know, at some time or another. I mean, we do it all the, you know, kind of quite regularly. But I think what you're describing is just another, it's just such a different level, isn't it? It's so
absolutely.
constant and it's so significant, and it must just add so much additional
Yeah,
stress, you know,
yeah,
from as well as,
absolutely.
you know, as well as actually struggling with your memory
Yeah.
and your concentration, but the actual after effects of it are so stressful in themselves.
Exactly. And again, that this is the definition that it impacts your social life. It impairs your personal life, impairs your professional life. That's when it becomes a disorder. Before that, it's not a disorder. If you're coping well with it, you're dealing with it, and it's not excessive. It's not. I can give you one example. I remember my wife keeps a glass of water up there. There's a yellow glass, or plastic glass of water that she keeps, so that it's a cue for me to remind me that I have to take my medicines in the morning. So every time I go there, the glass is there. One time I was rushing out, and I I remembered that I forgot my lunch, so I went inside and I saw the cup. So, oh damn, I have not taken my medication. So I took my medication, I put the glass back, didn't pick up my lunch, the thing that I came for, and went out and traveled 2 hours. And by the time I reached my workplace 2 hours later, I realized that I've not picked up my lunch. So these are the kind of things that happens on a day-to-day basis.
Mm,
This is a picture of predominantly inattentive type. Um, and again, people call them lazy, people call them forgetful, people call them people who are not serious in life, and that's not the case. They try their level best. The second type is hyperactive, impulsive type, in which they're fidgety, they're unable to sit still. They have to get up, move about every 10-15 minutes because that causes them a lot of stress. They bite their nails, they fiddle with their hair, beard, everything. They will playing with the fingers, their legs are bouncing. They've got more energy than anybody else. They'll be as children, they'll be climbing on rooftops, trees, fences, getting injured, getting hurt, but not learning the lessons, running around amok. And by the end of the day, they have got so much energy that they're unable to go to sleep. And people find it difficult to cope with
mm,
their energy levels. They're loud, they're extremely talkative, over talkative to the extent that they would not realize that the other person is getting bored. They will talk and talk and talk and interrupt. If, for example, if an idea comes into their mind, then they will not wait for the other person to finish what they're doing. They will interrupt them. They do not know personal boundaries. They're very impatient, especially in children. Crossing the road is one of the things. They are known as dashers. They just do not look around, just dash onto the road. And the mothers and the parents have to struggle. They have to put leashes on so that they do not get on the road and have accidents. So this
yeah.
is the hyperactive
So,
impulsive type.
I mean, it can be so dangerous, can't it? I mean, such
Absolutely.
risky behaviors, as you said, the road safety, but you know, kind of climbing out of windows, and I mean, these are things I hear in my clinic, you know,
Yeah,
and and obviously as children get older, then they get into other risk taking behaviors as well
absolutely.
because of their impulsivity, substance
Absolutely.
misuse.
Uh, Again, the presentation changes as they grow older. So uh, there is a history of drug use, drug misuse from a very young age. When I say very young age, you'll be looking at 10, 11, 12, because
Gosh.
they will, because they're so vulnerable, they get into the wrong company and they started using drug, recreational substance. Alcohol is one of those. Um, if you look at the forensic demographics 40 to 50% of prison population is undiagnosed ADHD. This is as massive as that.
Mm.
If you look at the economy of ADHD, it's an undiagnosed patient costs £15,000 a year. And if you take the prevalence, which is 6%, so every six person has out of 100 has got ADHD, and you calculate it, you multiply it with the 15,000 pounds a year, you're looking at millions and zillions of pounds spent in doing the damage control. But what we're not learning is that we're not ready to pay to create services that can help those people.
What a powerful point, Dr. Khurram, because as we always say, prevention is so much better than cure,
True,
isn't
true.
it? It's always,
Yeah,
you know, it's always so
yeah,
important to try and you know, and prevent or intervene early, you know, at the very least to support, you know, people with these difficulties. But and
absolutely.
to really you know, to help change the trajectory of their
Yeah,
life. I mean, what we're talking about just now, you know, it
yeah,
starts in childhood as
yeah,
these kind of you know, these kind of difficult to manage behaviors that kind of progresses to delinquency, you know, substance misuse, getting into the wrong
true.
crowds, crime, you know, and then it kind of can progress to real like
Yeah,
lack of social functioning, can't it, with unemployment and criminal
absolutely.
record.
And nobody will be willing to hire them if somebody has got a criminal record. So
Yeah,
those brilliant mind goes to waste. So
yeah,
I was telling you about the types. This is the
yeah,
hyperactive impulsive. The third type is the combined type, in which you have got literally everything: inattention, hyperactivity, and impulsivity. And this is one of the most common ADHD types, the combined type.
yes. Well, thank you so much for explaining the three types, Dr. Khurram. We are going to be coming up to a short, but I can't believe the time. We are going to be coming up to a very short break soon. But subhanAllah, you've given us so much information already. We've got some questions coming in.
Yep.
I'll maybe take a question just before we go to the break. There's a message from Mariam Munir, and she is asking, what causes ADHD? And you did touch on that, but yeah, I wonder if you wanted to
Yeah,
add anything.
it's genetic. At this moment in time, the research says it's completely genetic. It's a neurodevelopmental disorder. There are certain genes which are implicated for the development of ADHD. As I said, there are certain other factors, for example, brain insults, uh, any brain injury, or any rare genetic conditions, for example, some syndromes in which the predisposition of ADHD becomes more. Uh, but the environmental factors, it's not it's not causative. It doesn't cause it, but at the same time, it can lead to an early progression of ADHD. So environmental factors like um, low birth weight, alcohol, and smoking and drugs during pregnancy. Those are one of the most important predisposition for
What
ADHD, development of ADHD.
what about parenting?
Yeah, parenting as such, it as I said, it leads to, like, it can quicken the process, it can hasten the process, but in no ways, at least what's the research, the latest evidence base says that it's not implicated as a causative factor. Actually, one of a very interesting point that you I'm about to raise is a strict parenting. Um, it actually is protective of the prognosis of ADHD, because strict parenting means that there's structures and processes in place. For example, I can give you my example. My father was my parents were strict. They were very education centered, and they wanted the best for their children, and they pushed us to do things, created structures for ourselves, and that became a coping mechanism for me, a structure in which I used to study and which I used to work brilliantly. So, permissive parenting during ADHD can have a detrimental effect because the structures are not in place, and hence the prognosis can be bad, can be really bad.
Yeah, subhanAllah, that's what my mind was going to, where parents don't have any boundaries, or
Yeah,
don't have, you know, don't try and discipline the kids in an age appropriate,
yeah,
of
yeah,
course,
yeah, absolutely.
manner, so that children don't learn about rules and regulations, and have limits put on their behaviour. Thank you so much, Dr. Khurram. I wish we could go on, but we need to take a short ad break, and then we'll be right back, inshallah. So, everyone, please keep listening to Radio Ramadan 365. We're on Late Night Live talking about ADHD. We're just going to a short ad break, and we'll be right back.
Radio Ramadan 365 Sound for the Soul.
रास्ते कितने ही मुश्किल क्यों ना हो, जब कोई साथ दे तो मंजिल मिल ही जाती है। गजाली एजुकेशन ट्रस्ट गुज़श्ता 25 सालों से लाखों बच्चों को स्कूल में ला चुका है। आपकी मदद से पाकिस्तान आगे बढ़ सकता है, हर बच्चा पढ़ सकता है।
दुनिया को जगाना है, सबको बताना है, रमजान में मसलों को रास्ता दिखाना है। With years of experience and an extensive portfolio, Shield Associates provide an excellent accountancy and bookkeeping service. So if numbers and deadlines are giving you a hard time, come along to our office on 215 Albert Drive. Shields Associates, the accountants you can trust.
The famous Jassit's Halal Pies are finally available in Scotland. Freshly baked Jassit's Halal Pies come in 12 mouth-watering varieties, like steak pies, chicken and mushroom pies, and cheese and onion pasties. Also a variety of ready meals. There's something for the whole family, and all HMC certified. At House of Halal and other good outlets. House of Halal, 76 Tradeston Street, Glasgow, G5 8DZ.
Radio Ramadan 365 Sound for the Soul.
Assalamu alaikum. We are back here at Radio Ramadan 365. You're listening to Late Night Live. My name is Dr. Sadia Muhammad, and I'm joined tonight by Dr. Khurram Sadiq, a consultant neurodevelopmental psychiatrist and a TEDx speaker on many topics, but on ADHD, which is what we are talking about tonight. Welcome back, Dr. Khurram.
Thank you very much, Sadia.
So we were having, it was a fantastic discussion just before the break. You were giving us so much information, and mashallah, lots of comments coming in. People are watching this on Facebook Live and also on the Radio Ramadan 365 YouTube channel. Please keep your comments coming in and your questions. And we also have a caller, I think, who will be joining us just shortly. So that'll be really nice, and to get a live question for yourself, Dr. Khurram.
Yeah.
But before that, I wondered if we could move on. We talked about what is ADHD, the sort of, the features of ADHD, how it can impact on children's lives, on adults who have ADHD. Let's move on to talk about what can be done about it. What is the treatment for ADHD?
Okay, so the treatment is different in children and adults. And when we talk about children, we talk about kids as young as 6 or 7 years of age. I think the first thing that the NICE guidance, which is the National Institute of Clinical Excellence, it tells us to have some behavioral techniques. For example, if somebody is distracted, they should be sitting at the front row to a corner, not close to a window. In assemblies, they should be the last one in. They should be the first one out. They should have one-to-one time with the Senko. They should have clear instruction. They should be visual timetables provided to them. Things like that, and a lot of other behavioral techniques for home as well as parents. Parents are encouraged to attend training courses, ADHD training courses, parental training courses that will be helpful for in order to deal with their kid. Now, if that does not work, then some kids they're given cognitive behavioral therapy for ADHD. If that doesn't work, then we go to the third one, which is the medication. And the medication, the first line, there are two types of medication. There are stimulants, and then there are non-stimulants. So stimulant medication means that they are kind of derivatives of amphetamines, but they have been produced, or they have been formulated in a way which is not injurious to health in the in the short term as well as in the medium term. But when it comes to the long term basis, there's some suggestion that it causes cognitive decline. But that's you like using it for 10 years, 15 years, 20 years continuously. uh, the stimulants are very powerful. They It comes in different kind of preparation. For example, there's an immediate release tablet, there's a slow release tablet. Immediate release can be taken multiple times a day, whereas slow release can be taken once a day. And it depends on their half life, or as to how much time they spend in the body. Immediate release is usually in the body for 2 to 3 hours. So there's a flexibility around using immediate release, whereas long term means that if somebody has got a schedule of 9 to 5, they can easily use that. Now, in the non-stimulants are used if the stimulants are contraindicated, and the conditions in which they're contraindicated. If there's a structural damage to the heart, if somebody is struggling with a valvular disease, or a morphology or a structural change to the heart. If there's a strong family history, then we usually do all the investigations necessary, take opinion of the cardiologist, and if they can go on stimulants, we do. Otherwise, we go on to non-stimulant medication, which are effective, but not as effective as the stimulant medication. This is usually happens in children with support from CAMS, which is Child and Adolescent Mental Health Services, where they get support from a clinical psychologist, from a psychiatrist, from they have their care coordinators. Uh, the management is slightly different in adults. In adults, the first line is medication. So we try medication. Along with that, if it is moderate to severe ADHD, then we can go for cognitive behavioral therapy ADHD, which is effective in some people. But I'm quite skeptical about it. I'm skeptical in the way that if a person has got problems in sitting down, concentration, attention span, it's very difficult for them to sit 50 minutes and do the stuff, which can be very boring for them. Alternatively, there is a thing called ADHD coaching. So ADHD coaching, they're accredited ADHD coaches with lived experience, which are one of the best coaches. They provide you hands-on approach towards ADHD. This is a problem. These are the four solutions. You can implement it in this way, which is what ADHD is all about. ADHD is about problem solving. They have a problem, they want a solution to that. And ADHD coaching fits right in.
Yeah, no, that's great, and I think there's nothing that can compare to lived experience.
Yeah,
If you've got
true.
lived experience,
Yeah.
it's just so. I mean, even in the sessions that I've been doing with yourself, Dr. Khurram, it's just been different. Because I'm speaking to you as a professional and an expert, but also someone with lived experience, and
Hmm.
that is different to seeing a patient. Because I'm getting so many insights from yourself.
Absolutely.
So I think that's great. So the for for adults, the first line is medication. In children, as you explained, it's not the first line, especially in the mild to kind of moderate level
Yeah.
of ADHD.
Yeah.
Moderate to severe, again, we would you know implement the behavioral
Yeah.
strategies
Yeah.
and psychosocial interventions,
Yeah.
but medication
Absolutely.
is definitely used. But as you kind of indicated, there are side effects that are associated with any medication,
Yeah.
and including stimulants. So therefore you really need to have a proper assessment and checks done to make sure that it's safe for you to
Absolutely.
be on those medications. So no, that's really helpful. And actually, we did have a caller who actually is someone else with lived experience of ADHD. I'm not sure if
Mhm.
they're with us in the on the line. Maybe our studio support could help to bring them in. While that's happening, oh right,
Hello.
we have assalamu alaikum.
Hello. Walaikum salam.
Uh, Thank you so much for joining us. I believe we have Uzair Rizwan with us.
Yeah.
Is that right? Yes.
Yeah.
Welcome to the show, Uzair. So
Thanks for having me.
thank you for joining. So I believe you are 21 and
Yeah.
you have ADHD and you've been on medication for a few years. Is that right?
Yeah. For 3 years.
Yes. And you wanted to ask Dr. Khurram some questions.
Yeah. So I had some questions. So
Yes.
I read that you have some expertise on gaming.
Yep.
So like as someone with like ADHD, I
Yep.
usually like enjoy like highly stimulating tasks.
Yep.
And since I was younger, I always loved games, but I've never quite been sure because I know that it must be good for my cognitive skills, but the
Yep.
addiction side of it
Yep.
must outweigh that side. So I just wondering
Sure.
what your opinion on that was.
Well, I think a lot of people who have got who are neurodivergent, especially ADHD
Yeah.
and autism, they gravitate towards gaming, and
Uh,
for two different reasons. Like with ADHD, the reason is that it's a dynamic landscape. Gaming, it keeps on changing. It's never boring. You're anticipating things, and you get embroiled into that world. Um,
yeah.
of course, not every game, but those games that are fast paced, especially
Yeah.
first shooter games, things like Fortnite, people just are gravitated towards it. They're so engrossed and engulfed in it.
Uh huh.
And definitely, the other side is that it can lead to addiction. And there is this time blindness that comes with ADHD, where you are doing things without realizing that you've spent hours and hours and hours, and these are the periods of hyper focus for yourselves that literally can sometimes go wasted. And I agree that the cognitive side of it, that it can help improving certain cognitive aspects, but then there's certain studies which have been done with regards to gaming and those cognitive effects, positive effects, and they do not translate into the real world, because real
Mm,
world as well as the the, the fantasy world, they're two different realities.
yeah.
You don't get chances in real life as much as you do get in your fantasy world when you're gaming. I was a gamer once, so
Yeah.
I know about it. I was a gamer till PS3, and after that, I realized that if I get stuck in this, then definitely I'm going to lose my career. So I said goodbye to gaming at that stage.
So
So
what would your advice be like to me for
yeah,
gaming?
I think the first advice is to cut it down slowly. Don't don't use abrupt means. For example, if you're gaming for 8 hours, don't expect that it to go down to zero in 2 days, 3 days, a week. Do it very slowly. Do it 15 minutes, half an hour. Put alarms in place. Now you'll soon realize that once you're cutting down, you have got more time left with yourself, and you don't know what to do. So make sure that you use that time and you fill that time with certain activities which are beneficial to yourself. It could be interaction with friends, it should be connecting with nature. I can tell you that in South Korea, they took 2 million of their children to boot camps, and in a year, because they were afraid of social media and gaming addiction. And in those 3 weeks or 4 weeks, they they asked them to completely disconnect from their devices and connect
Yeah.
with nature and people. And the results were brilliant. Only 25% of them relapsed back to gaming and social media.
Yeah.
So interacting with people, finding something which is beneficial to you. You know yourself better. What are your hobbies? Explore.
Yeah.
Explore. If you cannot explore, go to somebody who can help you explore yourself into some activities. If you don't mind me asking, Uzair, what type
Yeah.
of ADHD have you got?
So when you were describing the three types, I would so previously I my mom believes that I have like 2E ADHD.
Hmm.
I'm like when you're describing the three different types, I wouldn't say I'm like a set one type. I would say I'm a
Okay,
mix of like
the
three.
combined type.
Yeah, because like you were saying that the inattentive type had their room like a bomb site, but I'm quite like OCD
Yeah,
instead of
yeah,
messy. Like I have everything like overly organized in my room,
mm, yeah.
but like mentally I'm not very organized with like
No, true.
appointments being on time. And then I am slightly inattentive, but
Hmm.
it's only when something doesn't interest me or
Hmm.
like I'm bored.
Hmm.
Like the lead up to joining here, I was getting really frustrated,
Hmm.
and then the
Okay,
so
okay.
yeah.
So it's looks more like the combined type. Are you hyperactive?
See, sometimes I can be like very hyperactive, but then sometimes I can feel like really
Yeah,
lazy, like I don't want
yeah,
to do anything
yeah,
or I can't be bothered. But then
yeah.
sometimes I have like a lot of energy, especially at night for some reason. Like I can't sleep at night.
It has its, because as you grow older, the hyperactive component of it decreases with age.
Yeah,
And you, children who are extremely hyperactive, they then become hyperactive in spurts, because the
yeah,
dopamine and norepinephrine is released sporadically. So
yeah,
time when you feel energized is the time when dopamine and norepinephrine is released. The time when you feel extremely lazy and you're procrastinating
yeah,
and literally thinking about something to do for hours on end and stressing about it but not able to do that, that's procrastination, because the
yeah,
dopamine and the norepinephrine is not getting released at that point when it actually needed.
yeah.
So that happens in spurts. So I think for you, important advice would be find what interests you other than gaming,
S-
slowly and gradually incorporate it into your life. Cut down on gaming step by step. What you have to understand is that we live in a completely different world.
Yeah,
If you're interested in gaming, nobody is telling you to come off it completely.
yeah,
But there needs to be a balance between reality and fantasy. That, for
yeah.
example, an hour, 2 hours, 3 hours maximum, and then you go to something which interests you, which can be meeting people, interacting, sports, something, a
Yeah,
hobby of
so
yours. So slowly
yeah,
and gradually replacing it. Um,
I'm like
but
really sorry.
yeah, please go ahead.
So I'm like really interested in physical exercise like
Yeah,
gym,
yeah,
football, like fighting. Like I want to
yeah,
do all these things. I
yeah,
usually do them, but like I'm in university at the
yeah,
moment as well, and
yeah,
I find it so like boring. Like I can barely like get work done, but I have like football at night, and I'll be
yeah.
looking forward to that instead of like studying. Like I
Mm-hmm.
want to do everything but studying. Like whether
Okay.
it's gym, like
Mm-hmm.
some university, football match, or
Okay.
But do
boxing.
you enjoy what you do? Is there? Are you enjoying your
Yeah.
what are you doing at university?
So I'm doing economics, but the problem I do like economics, but the problem is the university makes it very boring. Especially the way of teaching, and so I have to take two or three other subjects with my economics because I'm in
Yeah.
second year. One of them was psychology, but that drove me insane. And marketing. I really like psychology since I was younger, but when they give me topics that I find so boring, like memory and sleep
Yeah.
and conformity, like this is like stuff I'm not interested in at all. And then it makes like the rest of it bad for me because I'm not really interested in those like big topics
Mm-hmm.
that take up months at a time. Like I
Okay.
only want to learn psychology on parts that I'm interested to know or that would be useful to me.
Mm-hmm.
So it's
Okay.
mainly like I'm doing marketing and other stuff and business communications, and like that's really boring. But the one subject that I do like, economics, that's only like 1/4 of my grade.
Okay.
But have you said, sorry, you've been on medication, haven't you?
Yeah, so I
Did that help?
so I'll just tell you like from the beginning. So I 3 years ago, I prompted my mom to basically get me medication or something, because like it really wasn't working for me at school. Like I was having
Mm-hmm.
like a lot of issues, and my teachers always said that he has a lot of potential. Like
Mm-hmm.
he could really do well, but he just doesn't try and
Yeah.
stuff. So after like a few months with the CAMS, they started me on what was the one, Ritalin,
Okay. Yeah. Yeah.
and it made me like a complete zombie. Like I was
Mm-hmm.
just fixated on like either games or not speaking to people or like being in
Mm-hmm.
isolation and getting
Mm-hmm.
aggressive,
Mm-hmm.
because that's like completely against my nature. So
Yeah.
I stopped that and I started lisdexamfetamine,
Yeah.
and at the time like it changed my life.
Yeah.
Like I never had like such an influx of dopamine or
Mm-hmm.
like stimulation in my life. Like
Mm-hmm.
I finally started doing all the things I was like procrastinating about doing
Mm-hmm. Mm-hmm.
and stuff. But after like 6 months to a year, the effects started diminishing like heavily,
Mm-hmm. Mm-hmm.
and like more problems started coming out. Like at the start, I was getting like very overly like OCD, and like
Mm-hmm.
my
Okay.
personality was like fading. Like I used to be like the center of attention in the room. I didn't stop
Mm-hmm.
talking, then I got
Mm-hmm.
quieter
Mm-hmm.
and less social, and like
Mm-hmm.
it's come to this point where I only used to take it so I could get out of bed in the
Yeah.
morning. That's the only thing it did for me.
Okay.
It
Okay.
just, yeah.
One suggestion to you is, again, it's uh, there's some people who have come to me and they've asked me that, can ADHD medication give me OCD, or can ADHD medication make me more recluse? So no, it doesn't happen. But if there is an underlying autism spectrum disorder which can coexist with ADHD quite a lot, only in those cases, because once the ADHD side is managed, the autism side becomes more prominent, and that means more organization, which is happening in your case, less interaction with people, more detachment with society, which is very typical of autism spectrum disorder. Have you ever thought of having an additional autism spectrum disorder assessment?
Uh, I'm just asked, did I not have one of them when I was younger? Remember, with the ADHD? No, I don't think so. But I completely understand what autism is, and I have
Mm,
like quite a few friends that have it, and
yeah.
I'm sure like my uncle,
Hmm.
cousin, and stuff have it. But I'm I'm nothing like that at all.
Hmm.
Like I
Yeah.
thought about that before,
Yeah.
but like when I was younger, I started like speaking very quick, like within a
Hmm.
year,
Yeah.
and like my verbal skills have always been very like
Hmm. Hmm.
advanced for my age.
Okay.
And like I had when I was younger, I had no problem in like
Hmm.
learning behaviors or
Hmm.
replicating behaviors. Like
Okay.
I was always quick to learn things,
Hmm.
so that's what makes me think that I don't
Hmm.
have that.
The only thing is that once a autism and ADHD coexist together, it's a
Yeah.
different presentation. It's
Hmm.
not it's not a very, for example, the ADHD in a coexistence of autism and ADHD presents very differently. They're not as chaotic and they are not as disruptive as a pure ADHD would be. And so
Yeah.
is the case with autism. They're not as recluse, and they're not as detached as they usually are in cases of pure autism spectrum disorder. So
Because but sorry.
yeah, so in a way, it affects each other. It affects each other, and I always tell people that once the smog has been blown away, which happens when ADHD is managed, the the symptoms of a autism spectrum disorder can actually become more prominent. So the presentation, if you, because no one autistic person is similar to other. There always are variations between autism spectrum disorder. I think it's worth looking into that. That
Yeah.
would be my advice to you. At the same time, when was the last time you had your lisdexamphetamine reviewed?
So the last time I took it.
Yeah, the last time the dose was reviewed, the doses was reviewed, or you were seen by a psychiatrist.
So basically 2 years ago, and the problem is like I've told them several times that I
Mhm,
want to
mhm,
decrease my dosage. My mom's asked as well, maybe over 5 times, isn't it?
mhm,
Like every month I was phoning them, and they're
mhm,
saying basically it's easier for us if you just take out yourself
mhm.
and reduce the dosage yourself. But I said that's kind of not the same thing.
No.
So for a few months I was doing that, and
Mhm,
I was cutting down.
mhm,
But then what would happen is like 1 month I'd be on only 1 day left, and then I get from the pharmacy, then I take the normal dose again. Then the
mhm,
next day I take the 50 mg,
mhm,
and basically I'd felt like some sort of like withdrawal from taking a lower dosage.
mhm,
Like I didn't manage to reduce it properly. For
mhm,
example, one time I managed to cut down to 30 mg,
mhm.
and that whole month it basically felt like I needed basically more to manage
Yeah,
symptoms, even though
yeah,
they're both bad. They
yeah.
weren't doing anything.
So you have not been seen for 2 years by a specialist.
Is that yeah,
Yeah,
that's true.
I think just push for that, because me talking to you is a very different experience than to specialists talking to you
Yeah,
face to face or virtually, who would know the ins and outs of it.
Mm.
yeah,
And the second thing is, my advice to you would be check yourself for autism.
yeah.
Yeah.
So
Thank you so much. Thank you so much, Dr. Khurram and Uzair, for calling in. I'm really sorry we're going to have to end your call just very soon, Uzair. But
yeah.
thank you so much for your questions. And we did do a session just 2 weeks ago with Dr. Khurram on
Yeah.
autism, and you can check that session out. And
Sorry, I just
obviously,
have a last question. I was going to say to the doctor that I've decided that I'm not going to continue with taking Lisdex anymore. So
Okay.
before Ramadan, I'd stopped, and now I'm decided that I'm not going to take it again. So I just
Okay.
wondering if you have any advice on like supplements or other ways to manage ADHD.
I think
just
go
very
for ADHD.
quickly, just very quickly, Dr. Khurram.
Yeah, yeah. Go for ADHD coaching. Either
ADHD.
ADHD coaching. Yeah, ADHD coaching. Look into that.
Okay.
Yeah.
Thanks so much for your information. It's been a big
No,
help.
no problem, sir. No
Thank
problem.
you so much,
Thanks
Azar,
so
for
much.
calling in.
Thank you.
Jazakallah
Take care.
khair. It's so nice when we have callers, and absolutely, it's it should, taking taking advantage of the amazing opportunity to speak with an expert like Dr. Khurram. Dr. Khurram, that was really fantastic. Really. Very helpful information that you've been given. The comments have continued coming in. We're coming to the end of our program, and I still had a couple of questions actually that
Yeah,
I needed to ask you. One
yeah,
was actually from my daughter,
yeah,
and one I think I'm just speaking on behalf of lots of parents out
yeah.
there about screen time. So let me ask you the question that my daughter had first. That was just, if you think somebody in your class, she's 11, if you think somebody in your class has ADHD, how can you as a friend support them? So
Mm-hmm.
that was her question. And the question on behalf of all the parents listening
Yeah,
in
yeah,
and not is screen time.
yeah,
Does that, and we touched on that with gaming. I'm so glad
yeah,
Ozair brought
yeah,
up the issue of gaming, but screen time more widely and the
yeah.
impact of that on ADHD.
Okay. Now, as an 11-year-old and you have a friend who has got ADHD, I think the important thing is you can have the person's back. For example, they'll be forgetful, they'll be leaving things, they will be forgetting about their homework, things like that. Their their day-to-day stuff would be lying around and they would not pay attention. So you can help them in this way. You can remind them of things. You can remind them of doing the homework, um, and be that friend who can support them in their difficult times. There's nothing much you can do apart from that. But even doing that, reminding them for of their homework, reminding them to take their stuff, reminding them to take their lunch boxes, water bottles, because it also causes an economic burden on the parents. There's so many parents who have told me that they have been buying coats every week or every 2 weeks, every 3 weeks, because the child keeps on losing it on a
Mhm.
regular basis. So you will be a lot of immense help to that person by just doing those very simple things
Do you
and
know,
be as supportive as possible.
Do you know, Dr. Khurram, honestly, the number of things that go missing in her school, from the kids, and I never actually, again, it's like a pin drop. Again, because I'm just thinking, I never actually put that together with, oh, is this possibly a sign of ADHD?
Yeah, yeah,
Maybe if it's happening in the same child again and again,
yeah,
it would
yeah,
make you wonder, isn't it?
yeah,
But no,
absolutely.
no, thank you. Yeah,
Yep.
and the second question.
And the second is screen time. Screen time is so important, especially um, WHO has clearly said that from 0 to 2 years of age, there should be no screen time. Like even not television, because that impacts on your brain. Brain is growing at that time massively, immensely. It's multiplying. Cells are multiplying, and um, and it impacts how the synaptic connections are developed between different parts of the brain. As the person grow older, you need to have a control. You need to manage their screen time, have social media breaks or phone breaks. If they come to the living room, they have to drop the phones, or leave the phones outside. There should be a curfew as to at what time they should leave their phones and not be on it. There are apps which are available, or programs which are available, where you can actually control all their activity through your phone. So that would be helpful.
And is there like a time, a guidelines around like sort of time? I remember hearing like an hour. Is it an hour a day, or was it 2 hours a day?
It depends on the age. For example, if they're 10, 11, yeah, two
Yeah,
hours. Because the thing is, you cannot just alienate them. This is a
yes, of
technology where
course,
you have to live with it. So
absolutely.
having best of both the worlds, social interaction as well as time on the phone, because this is how the Generation Z or Gen Z are connected with each other and connected with the world, with the online domain. The work is on over the phone. The friendships are over the phone. The entertainment is over the phone. So you cannot completely block it. But 2 hours, yeah, 2 to 3 hours, depending on the age bracket. I think that should be the limit.
So kind of secondary school age, you would say 2 to 3 hours, but that would
Yeah.
include like, what they're using for their work as well, for
Yeah,
their
work as
school.
well. I like encourage them to not use phone and use laptops for their work, or use bigger
Okay.
screens, for example, iPads for their
Yes,
work.
yes.
And there
Okay.
are other devices, for example, there are so many other tablets that I have found. For example, I use a tablet called Remarkable to make notes, and it's a handwriting device, and it converts writing into words, and it stores the information, but it's not a surfing tablet, so it doesn't cause you that distraction. People who love to write or people who love to draw, that's the best tablet for them.
Brilliant. So great, you're getting some gadget advice as well from Dr. Khurram. It's been an amazing session, Dr. Khurram. I can't believe the hour is up. We could go on, and there's so many things I haven't even asked you. I mean, I was thinking about sort of taking the discussion further to thinking about ADHD in girls, because that's quite
Yeah, yeah.
a big thing as well.
We
We
can
talk
have
about
another session at
ADHD.
some point later
Yeah,
on.
I'm sure we will. Definitely, we will, because I think when we talk about ADHD, I think just generally our mind tends to go towards boys more than girls, but actually it's an and it really is a big issue and a big problem for girls as well. But it doesn't present the same always, and they can be
Yeah.
missed, and that can lead to
Oh
lots of
yes. Oh
consequences
yes.
as well.
Exactly.
But we'll do that another time, inshallah. But thank you
Sure.
so much, Dr. Khurram. It's been
Thank you so
wonderful.
much.
And thank you to everybody who's been listening in, who's been sending in comments and asking questions, and to Azar for coming on the show. Dr. Khurram, just in 20 seconds, your last words on ADHD.
ADHD is an amazing phenomena. Take it as a positive. You're creative. You're brilliant. You're fast-paced. You just have to manage yourself. Once you manage, you'll do wonders. So just cherish it at the same time.
Such phenomenal words and such a positive note to finish on. Thank you once again,
Thank
Dr.
you.
Khurram Sadiq,
Thank you, Dr. Sam.
specialist in neurodevelopmental disorders and 5 times TEDx speaker. Check him out on YouTube, online, and definitely is TEDx talks are amazing. Thank you so much. And inshallah, everyone, please have a wonderful night, 23rd of Ramadan. Please remember us in your du'as as well. And until next time, Assalamu alaikum wa rahmatullahi wa barakatuh.